Hi, I'm Kathryn Lopez from the National Review Institute, and I'm so grateful to be able to welcome you on behalf of both NRI and the American Enterprise Institute, which is co-sponsoring this discussion on how a divided country can come together for our most vulnerable children. And with me is Lynn Johnson, who was Assistant Secretary of Health and Human Services running the Administration for Children and Family under the last administration, and Naomi Riley from the American Enterprise Institute, who really has become, Naomi, one of the most important writers and analysts on these issues of child welfare. And so thank you for doing that. And thank you to AEI for supporting that work. And Naomi and I are really excited to be able to ask Lynn Johnson to join us to really download some of your wisdom from the really important work that you were doing under the last administration. And, you know, it's not the kind of work that is on everybody's radar unless it becomes some kind of scandal, right? Or there's some, culture war kind of fight going on. And the fact of the matter is there are children and families who are living in this bureaucracy, wanting to do good, wanting help, and the government doesn't always make it easy. In fact, it makes it almost impossible sometimes, which is some of what Naomi's written about. Can you just start, Lynn, talking to us about what? Well, first of all, congratulations being out of Washington. Now that you have the perspective of being back home in Colorado, what are your thoughts on what you did during your time in Washington?
That's a very loaded question, but thank you for asking me to be here and to talk about what we did and how it impacted our country. As it took me a while to get confirmed, and I loved this job. I mean, it took me 16 months, so I had 2.5 years to really decide what I was going to do to help make things better. And that was not politically motivated. It was for the people that we serve. My entire background is working in some type of human service type work, whether it's with the homeless, the hungry, child welfare, or running human service departments. So when I stepped in, I wanted to look at what we could do that would have the biggest impact, that would be able to have results. I'm one of those people that, because I worked in local government and in state government, that I'm not much good at being dictated to about here's what we think will work from above. I'm much better at talking to people who are sleeping on the streets, or who have been abused or neglected, or who are hungry or scared or uneducated, and say, what would work for you? And from that point, find the solutions. So that's what I took to Washington, D.C. Worked with my teams. You all are very aware. When I walked in the door, we were having the biggest surge of unaccompanied children in history. We had had a huge surge with previous administrations, but we had children 2 months old, 6 months old, being dropped off in our country with no parents. And then I was working with the Children's Bureau. So I had two different child welfare systems, so to speak, that weren't completely aligned. So I worked on that alignment. Our mission was strictly to care for children. It wasn't immigration. It wasn't changing the laws. It was, how do we take care of children, both domestically in Children's Bureau and in the Office of Refugee Resettlement. So that's what I set out to do. We needed to have some alliance. We needed something realistic. We needed common sense measures. Trauma for a child being removed from a home is no different than trauma for an 8-year-old dropped off in the United States with no parents. How do we take care of both so they thrive and end up not in a system? So that's what we did. That's how I started, really digging in on why is it so hard to do what the federal government was asking us to do? Why did we not talk to each other in ACF, HHS, or other federal agencies? And I heard that loud and clear from everybody. Why don't you all work together? So we worked on that. And then we started integrating to get to outcomes and looking at all the compliance issues that don't get you to an outcome, but it's paperwork. 60% of my staff's time was spent on paperwork and 40% in my previous job on seeing kids. Let's flip that on its head. We have got to do better than that. The taxpayers deserve that. The children deserve it. The families deserve it. The communities deserve it. And when we get rid of all those extra steps, we have thriving communities. And I think that's everybody's goal. So that's just a real quick recap.
What can I ask you? I mean, a lot of the problems probably didn't surprise you at all because you've been working in this area, but what surprised you the most being at the federal level?
This is very silly, but the acronyms. I've been 4 years in human services, and the federal acronyms are different than anything else I'd ever heard. So it took me a while to figure that out. The bureaucracy, how long it takes to get something done, and the questioning of, yes, you need 35 pieces of paper before a child is safe. Well, I'm not sure the paper is what made them safe. And all those actions by a caseworker took them away from the real business. But the intensity of the need for the bureaucracy for kids to be safe really surprised me. We have the laws. Naomi would tell you this. We have the laws. If we would enforce those appropriately, if we would do what we're supposed to do, you don't need those 37 pieces of paper because you have outcomes and kids are moving successfully either back home or into successful homes. So I think the time, how long it takes to get anything done really, really surprised me. And being new to the district and to the Beltway, it took me a while to get what I say my sea legs to figure that all out. How do you get something done? How do you walk it through? How do you keep it from being blocked? How do you really, really do something well? And that really was a shock. So in 2.5 years, I did figure out some of it and we did get some of it done, but it was overwhelming. I was really, really surprised by. Everybody told me about that, but I was like, oh no, I can do that. It wasn't as easy as I thought, but once I figured that bureaucracy piece out, there are ways, but it shouldn't be this hard.
And isn't that the theme for most of what you write about, Naomi, in child welfare? It shouldn't be this hard, right?
That's right.
Yeah, it's kind of interesting, and I'm curious, how you sort of square this circle, Lynn. I mean, on the one hand, I think you're right that we have this situation where there's too much paperwork. But on the other hand, it seems like we also still are lacking a lot of important information about what's going on the ground. So as much as we're requiring people to fill out, every form in triplicate, it still seems like there's a lot of information at the federal government that's either not available or, is kind of muddled. We have states have very different ways of reporting data. And it's very hard when the federal government goes to kind of compile that information. For instance, one of the things that I've been writing about a lot is what do we mean by child neglect? And when the federal government goes and reports, for instance, how many children have been taken into foster care, removed from their biological homes as a result of neglect, those numbers are just all over the place. Some states could report that 80% of their removals are neglect. In some cases, they might report 20%, and everyone has a different sense of what that means. So I was wondering, when you think about this whole idea of reducing paperwork, how do we do that, but at the same time, be more effective about collecting the kinds of information we need to make decisions at the federal level?
Naomi, that's a great question. And I think where we're missing to get to success and outcomes is we collect a lot of paperwork, but what does any of it have a true meaning to get a child into a safe home or to prevent abuse and neglect? I keep hearing that about 60% of the removals is because neglect is based on the consequences of poverty. And if that's the case, then what does that look like in each state? And some states define neglect as poverty. Some states define it different. But when we get it at the federal level, we don't have those real cryptic definitions from the states. One young boy talked to me and he had been moved from his home because the family, dad lost the job. They didn't have a mattress for him to sleep on. He ends up in our foster care system ultimately for 10 years. And I think of the cost in trauma and emotions for both the parents and for the children. And I think about the couldn't we have bought a mattress and then wrapped around services for employment and housing or whatever the needs were to be more successful than to remove a child and to punish parents because they lost their jobs or they don't have housing? And so I think when we talk about neglect, you're absolutely right. What each state does is so different. And then we move the child into our foster care system. And again, the focus isn't success for that child. I mean, everybody's hardworking, everybody has good intentions. But when we look at the end game of children should be safely in their homes with their parents unless they are being abused and neglected and harmed, the foster care system should take care of those children so they can thrive and not cause more trauma. And then they should not age out to nothing because we haven't prepared something for them to go to. And if we keep those three things in mind, all the other data we collect is for what? If everybody was moving and focusing on the success of these children, we hit economic inequity, race inequity. We move the kids. They're not spending 2 decades in our system. We can make sure they don't have, I met one child, 92 moves. That's not okay. And I don't know that any of us would say that is. But when we look at the reasons why are much less than the intense trauma that they experience by being in our system for 2 decades. Did that answer your question? That was a long-winded answer.
It does, except I think that sort of tied up in some of what you said are some of the misconceptions that we're getting from the data from the states. I mean, the idea that poverty is really driving neglect, I think is really, shown to not necessarily be the case in a lot of states where you see substance abuse is really one of the huge underlying factors. And buying a new mattress and doing employment wraparounds are not going to solve the vast majority of the neglect-based removals that we're seeing. And so I worry that when states are sort of vague and when they're not, presenting us with, a real number and a real definition of neglect, that people will walk away with the idea saying, if only we had bought a mattress and if only we had, done more employment wraparounds, that could solve our foster care problem. And I worry that, unless we somehow, and maybe this is my next question for you, is how can, and is the federal government in a position to, given all of the money that we are giving to states, to push states to be more clear about what is behind the removals, about, how these states are doing in terms of how quickly they're seeing kids. I mean, even the kind of evaluations that we're supposed to be doing at the federal level of how well states are doing on a number of measures, how quickly you're seeing kids, how long they're in foster care, how long before they're adopted. I mean, can we be doing more at the federal level? And what was your experience in trying to do more at the federal level to kind of get states in line? Or is it your impression that we really, we can't, or maybe even that we shouldn't, use the power of the federal government to force states' hands on these issues?
I think we all, federal, state, and local, have to be focusing on making a difference and having that success that you mentioned. And you're absolutely right. The opioid epidemic, substance abuse is a significant reason why children are being removed from homes. At the same time, and I'll go back to my previous job, about 6-7% of my budget was for substance abuse treatment, yet it's one of the biggest problems that we had. And so we have to follow the money. If we want the success on the front end, we had the Family First Prevention Services Act, which Congress did, which was one of the most significant changes in law in history. And I was able to be part of rolling that out. And of course, it's never perfect when you're doing something new, but that prevention only came after we had the kids removed from the homes. What are we doing to prevent that call to the hotline so a child doesn't have to be traumatized first? How are we addressing those substance abuse issues? And the money needs to go to the treatment. But one thing that I think, and this is from my experience, child protection, child welfare, government entities are not the sole responsibility. They don't have the sole responsibility to prevent these things from happening. They get involved after something happens. Where are the services that help us wrap around a family when maybe a teacher knows there's something going on with a parent, or there's probation involved, or mental health systems, or the criminal justice system. Do the communities step up before the harm? Because there's no way child protection should be responsible for that. But I think about, in my situation, I'm running a human services, when there was a fatality before the system was involved, everybody looks at what child protection did. How come they didn't know about it? Why didn't they go out sooner? Didn't anybody tell them? The question has to be bigger than that. What can we do to strengthen a community, to strengthen families? So we're addressing substance abuse, we're addressing mental health, we're addressing these issues. You've heard some of the fatality stories where you had a probation officer in a home, you've had a child welfare worker in a home, and maybe somebody else, and then you get the call that 3 children have drowned in a bathtub. All 3 of those people that saw the mom did not share that they were in that house. How do we quit using confidentiality as an excuse and use all of our jobs together to start working towards success for those children and those parents? Ultimately, we end up having to take those children. And we need to do that right too. And this is a piece you and I have talked about. We need to know that foster care and other areas of government can work together for the kids that are already involved in our system. And someone did say to me, all of a sudden, for the last 4 years, you are doing primary prevention before the kids get in the system. First time ever, our AFCARS data is going in the right direction. Less kids coming in, more families getting wraparound services, more kids being adopted, less kids waiting. That's all good, but it is such a small change. It probably, who knows, but it's in my lifetime, first time I'm seeing numbers go in the right direction. And you all asked me, that's something I hope continues. It is so important. But we have 480,000 kids that were in the system when I started this. We have 125,000 kids when I started this that were waiting, of which 30% were already in the home that wanted to adopt them or wanted a permanency plan or wanted guardianship, but for the paperwork or the court hearing. So we had to pull courts together to say, why is it taking so long? And one young boy, this is one thing we did that I hope continues, is we engaged the youth. We engaged young adults who have aged out. We said, tell me what it was like in the system. Why was it that you didn't get adopted? Or when you did get adopted and it was a failed adoption, what happened? And we listened to the kids and we heard them loud and clear. It wasn't 50 kids. We had one phone call that we had upwards of 1,000 kids on a Zoom call sharing their experiences, saying, I wish it would have been like this. That is what is so important. We started tackling the waiting list. 122,000 children when I walked out the door saying, we need to get permanency. We need guardianship. We have to do better. We need those foster parents to be better trauma trained. We need the communities to wrap around foster parents. We need education systems to work together. There's a lot of we needs. And so what we did is we took this to the states. I met with all but about 7 governors, both Democratic and Republican, and said, will you be all in for America's kids? Will you help strengthen families on the front end and help get these kids into permanency on the back end? And will you work with your courts to get those moving that have been sitting, waiting? Because the kids told me they're in the home that wants to adopt them, but until they get that piece of paper, they don't believe it will happen because they've moved so many times. We have to follow up for these kids. We need action. The other thing I keep thinking about, there's not this sense of urgency. When I ran a system, now when I talk to the kids, I go, yeah, I have a meeting, and they'll say, okay, we'll meet again in 6 months. For a child, that's a long time. Where if it was my child, I'd want a sense of urgency, and can we get back together in 2 days? So how do we move the system? Because when we talk about these talented caseworkers and the workloads they have, it's because we don't move these kids. We could reduce significantly by 122,000 kids the numbers of kids they have to go visit. We can significantly reduce the number of kids coming in with serious harm by doing the prevention up front. And I would say if we did both of those, working with foster parents and adoptive parents, we could have a system at least a quarter smaller than what we have today. And when I talk
what do you
to—
think are the prospects in terms of, I mean, the judicial reform seems to be a huge sticking point. You will often get, and I think I have talked to, you know, people on the state level who are all for reform and changing things and moving things faster. A new governor will come in, you'll get a new child welfare agency head. But the courts don't change as fast and they don't move as fast. Family court is often the lowest priority within a state judicial system. You often, you know, get the people who are staffing those courts who are not necessarily the most motivated people in the court system, in the judicial system. They're often underfunded too, but I think that that's frankly a secondary concern. The bureaucracy is like molasses, and it does not seem like either legislatures or governors really have a lot of power to change how fast those things are moving. And especially in the cases where you're talking about, where really this is a matter of paperwork and getting before a judge and making this official, you know, those sorts of things. I wonder what you see as the avenues for changing that situation.
You're absolutely right on every single thing that you said. So what we did through our Children's Bureau director and his staff and myself and the deputy secretary and the secretary of HHS is we started reaching out to judges. And the judges started having conferences about this and having these conversations about this all-in challenge. Are we all in for America's kids? And we said, we can't do this without the courts. And we got chief judges and Supreme Court judges in the states to work together. And it was really fun to watch the eye-opening of, wow, when one of these young adults would go tell the judge, you know, I've been waiting on you for 18 months just to sign the paperwork because you couldn't get me on the docket. Or we heard communities that said, we'll put 3 permanency hearings on the docket a week, and you have 300 kids waiting. And so we started having the young adults who joined our youth engagement team reach out to all the other young adults who are in the states to be the ones who advocate with courts and governors to say, how can we help? And here's what we could help you with. It started working. It took the pandemic actually for us to learn some of this, because when we released all the flexibilities, and we did over 80 some Children's Bureau type of flexibilities when pandemic hit, we have learned that a lot of the things we require people to do are unnecessary for the safety of the kids. And they are actually thriving more when they're able to have, an example, more access to their siblings and their bio parents and their friends through a phone call than they were before, when everything had to be scheduled and you went to a place and then the parents showed up or didn't. And so by allowing more phone calls virtually because of the pandemic, the kids were thriving more because they didn't feel so cut off from family. So we saw some of that happening. In some states, one state, because of the pandemic, they went to virtual hearings and a lot of the other hearings didn't happen. And so they ended up with, in between March and October, 1,800 reunifications with caseworkers wrapping around those families and 3,000 adoptions. They don't do that kind of adoptions when there wasn't a pandemic. And then there was another state that said, we're going to put everything off until June of 21. So all of those permanency hearings aren't going to happen, and those kids are still waiting. If it was me and I was one of those kids, I can't imagine what that trauma would do to me. And that's what I think our courts and our systems have to keep thinking about, who we're dealing with. If we don't look in the eyes of these kids, which is why we started the youth engagement team, if we don't listen, if we don't talk to the parents, if we don't talk to foster parents, we are not going to do what is in the best interest of all of the kids. Every child is different. Like you mentioned, if I have to buy a mattress for one, I might have to get intensive substance abuse therapy for another. And we cannot just say one size fits all. Every one of these kids have a story. Every parent has a story. And often these parents are those kids that had the terrible trauma or the ACE scores when they were younger and no one dealt with it. And so we have to remember who we're dealing with both. So we do whole family, take care of those kids and move it forward. But the judges were very receptive. And so for those, it got to a point where I would end up calling some of the judges and say, hey, can you call your peers in this state? They're just not moving. And it would work. Judges will listen to judges. They weren't going to listen to me. But it was and then because we got all the governors were awesome. They knew their judges, they knew it, but they said, wow, I didn't know I had these waiting kids, because they and the system is built to respond to crisis. So once a child is in a safe foster home and sitting, they sit because the next crisis has come up. And we learned, and I talked to some.
Well, it's not just the next crisis has come up. It's also, I mean, there's also a sense in which, you know, why rock the boat? I mean, if you have a child, you know, who's been in foster care for a long time and you have the opportunity to, you know, to make that adoption permanent, or you have to do a hearing to sever parental rights, you know, a lot of judges are like, well, you know, we don't really need to go to those lengths just yet. The child seems fine. Everything seems fine. Let's just keep going this course. But there is this, you know, as you were saying, kind of a lack of recognition that until that child has that piece of paper, knowing that that's going to be their permanent home, they never know when it's going to be taken away, and they live their life accordingly. You know, with that kind of uncertainty that none of us would want for our children. So I think that there is a little bit of they have to go to the next crisis. But I think there's also a little bit of, you know, CYA, you know, a desire to not rock the boat, and, you know, just let's deal with the things that, you know, that seem most urgent right now, I guess.
Exactly. And it is, what we did that I think changed things is we put a focus on those three things. Wrap around the family on the front end as best you can, whether in the system or pre-system. Focus on the waiting kids. A gentleman who's with a very large nonprofit who's been doing this a lot longer than I have said there is no reason we can't get to zero. And when he says that, and I was thinking that, and we're on opposite sides of a spectrum, I know we can get to zero. And then we also worked with HUD, and they were helping us with homes for the kids that aged out. And I joked with them saying, my goal is that you don't have any aging out kids to place in homes. But they placed over 1,000 children into homes because we had gotten vouchers for foster youth. Then they wrapped around the kids that had aged out. These are all innovations that didn't happen before. And I'm praying and hoping that this will stay because the kids are better off for it. This is not a political issue. It is about those kids and the urgency.
And isn't getting to zero, isn't it necessary for faith-based groups to be getting involved? I often wonder that if we have a problem in our churches where people aren't asking questions about, you know, looking in the eye of the kids who are around and knowing what the needs are. We have a big problem in that regard, don't we?
We do, in a sense that this is, I was very, very fortunate to see the churches start stepping up to say, what can we do? Every person should not adopt. Every person should not be in foster care. But I have received more manuals from different churches throughout the country that I don't know if these are old or new, but they say, here's how you can help someone who has stepped up to adopt a sibling set or a teenage youth or someone who has mental health concerns or a physical disability. Here's how you, church member, and churches can train people to help keep someone safe in their community. Here's how you can find those parents who want to adopt, but they just don't know what to do. And the other piece of this was working hard to not take 2 years to get certified to adopt. Sometimes it takes 6 months, but every 6 months you do a new home study. And I jokingly said with my biological kids that if I had to take 2 years pregnant, I wouldn't have done it. And so if you can, I mean, why would you take 2 years to become certified just because it takes so long for paperwork, or every 6 months you have to have a new home study, or those types of things. And so I think there are things we can still do. And that's where some of the churches have come in and they have said, we'll do pre-screening. We will find parents that want to be there and hand that over to the child welfare systems. And I do think it's critical to mention it is any faith. It's not just one or the other type of religion, but anywhere where there are large groups of people, that get together on a regular basis, that is an audience of people that we can recruit to be foster parents and or to be adoptive parents or to give supports to families. And it's not because they're this religion, it's because they are people that gather every week and we know where they are. If I knew another setting, or if I go into a basketball game and approach the entire audience that's watching the game and say, hey, any of you want to be adoptive parents, I would. But we need everybody everywhere to understand these are America's kids. They are everybody's kids. And that was one thing we did. After talking to the governors, I reached out to the NFL. I reached out to baseball. I reached out to Hollywood. I reached out to all the churches, nonprofits. I had one call with 80 foundations on a call saying, you all are helping states with foster care. Can we focus on 3 things for 18 months? And if we can move the needle on this, then we can dive into the next big step to make sure the right things are happening. No one said no. No one said no, but we just started working on that 18 months ago, and we're done. But I'm hoping, it's called the All In Challenge, that everybody will keep this going. The governors, John Bel Edwards in Louisiana, a Democrat, the governor of Indiana, Eric Holcomb, and the governor Stitt in Oklahoma, Jared Polis in Colorado, all have said we'll work together. Kate Brown in Oregon, Gina Raimondo in Rhode Island. This was not political. They were all in, and they all cared. Governor Lee in Tennessee, Kemp in Georgia, everybody. For me to be an assistant secretary and have had personal conversations with each and every one, and they were in person until COVID hit, and then they were on the phone. Everyone said, yes, we will do this, but show us how. We gave them game plans. We talked to their child welfare staff. We helped with the community. We found which churches and which organizations, nonprofits, were out there. So exactly what you said, we have to have the mass audiences. And churches are good with that, and they are willing to do this.
I just wanted to sort of push back a little bit on this, because I do think that churches are offering something more than people who just come together once a week, and they're offering something more than your basketball audience is offering. I mean, they're a community, and the people watching basketball game are not necessarily a community. And so all of those great innovative models that we see in churches of families supporting other families that are doing adoption and foster care, that's not something that's easy to replicate through a basketball game. And I think that there are a lot of people, who do want to say, well, why does it always have to be the religious organizations? And why do we always have to, talk about the faith-based organizations are doing the bulk of this work. And, part of them are, the reason they're doing it is because they think God is calling them to it, but also they are practically and pragmatically set up to do this work.
That's right.
To support each other. And I guess that leads me to wonder, I know that you have worked across the aisle so much, but when you say this is an issue that is not political, I wonder, how you would, if we could get kind of drill down a little bit more there, because there are certainly political disagreements on these issues to begin with about how faith-based organizations should be treated. But even on issues like whether we should be following timelines for the Adoption Safe Families Act, like, whether we should just get rid of these things, or whether, we should abolish foster care altogether because of racial disparities. I mean, those are recommendations that are coming out of the mouths of politicians in Washington and around the country. So I'm glad that, you've been able to find these consensus builders, but I want to push back a little bit on what you were saying about how this is not political. And I wonder kind of what you think about the politics of this issue going forward.
Well, that's a softball that you just threw me. I think there's a couple things that I learned when I was talking to the governors. And as you heard, when I, kind of gave kudos to the governors that I did talk to on both the Republican and the Democratic side, is that when I took away the controversial issues, and you have to remember, I knew I had a year and a half. And so I was going to get done what I could get done in that time period that would have an impact. The longer conversation, which is what you're bringing up, is something that had I had another 4 years, I absolutely would have been tackling in a much bigger way. But I also knew I was not going to walk out of there without having some impact, some results, and some kids that were better off. So you're absolutely right about the faith-based groups. We have seen hundreds and hundreds and hundreds of churches step forward to be in the All-In Challenge. They have all stepped up. They are all putting together packages. They are all helping each other replicate what we've seen is working. And I will just throw out one that I met a woman, her name's Pam Parrish, and she is in Georgia. And she has a group that she started meeting these kids who are aging out. And so she started connecting them to mentors so they would have someone. Everyone needs someone. And they started doing that. She now has this organization where hundreds and hundreds and hundreds of kids have someone as mentors, unless they want to be adopted or they want to do something. And so when I saw what Pam was doing in Georgia, I talked to her about replicating that throughout the nation. She still is working on doing that. The First Lady was so involved and so interested in these faith groups and these nonprofits that are doing wonderful work. She started helping to spread all of this throughout the country. So as we moved the faith groups forward, we saw amazing numbers. And I think, as you said, if we were to dig deeper and you want to look at numbers in different states, those that used their faith groups had more adoptions the last 2 years. Those that reached out and people wrapped around them. Now, this is anecdotal. I didn't do the research, but when I looked at those numbers, I'm like, wow, you could tell. Let me see who do we know that's working adoption in that state? Is it Catholic Charities? Is it the contingent? Is it somebody else? And we saw how faith was stepping up to say, what do you need that's bigger than just praying? Because praying is big. But what's the action so we do no harm? When helping hurts, we don't want that to happen. How can we help? How can we be successful? And we started working with churches. Between our Children's Bureau director and myself, I think we were in every state, if not just one time, but more, with these faith groups, with these different organizations. And that's part of what I'm going to continue doing now that I'm not with the administration, is keeping these things happening with the churches and states. It works. We know it. We've seen it, and we have to really push it. And you're right. I don't think there'll be as much of an emphasis on the faith side. We had an Office of Faith in ACF. I don't know if we still have that, but those are the kind of things that are different.
On the question of the controversial issues, that is a significant barrier to conversation, and it's a miracle that you were able to push through with that, sort of big fog over people's heads. How is there a way to go forward when you have the Philadelphia case at the Supreme Court, where the Philadelphia city government just says no Catholic Charities anymore? The most effective agency now can't be in the game. Divided as we are, how do we move forward on these issues where there's this real sense from the party in power right now that there's a fundamental problem with some of these religious agencies?
I was asked that question in my confirmation hearing. Real fun. But I kept going back to the goal of all of these children need forever homes. And there are as many secular adoption agencies in each and every community as there are faith groups that may have different beliefs, and that no one has to go to the faith groups if they don't want to or don't believe that way. There are secular groups out there. And so whether or not someone believes the way of that faith group, that church, that organization, does not bind them to using them. And that was something that I said during my hearing, is I need everybody. I need those secular adoption agencies as much as I want faith adoption agencies, because people will choose. And it's the same thing. One of the senators brought up that he was Jewish, and he was very concerned that should something have happened to his parents, he would have been placed in a Christian adoption agency and forced to be Christian. And for the very reason that he was worried is why I want the Jewish services, Jewish agencies here in Colorado. They are a leader in our adoption work. And so the caseworkers should have that training and understand culture and understand cultural expectations. No different than if somebody was Muslim or if somebody is from another country that doesn't have the same faith or walk of life that I do. I shouldn't strip that child of it. That creates trauma. We should be able to align that child to help them move, to have a loving parent, and that those parents understand where they've come from and where their beliefs are and what that child needs. Cultural navigators are critical in child welfare. Respecting differences is critical in child welfare. I just love that all these kids that I'm working with, a lot of differences, whether they are LGBTQ, whether they are vegan, whether they are vegetarian, it doesn't matter, but they are still calling me. In fact, they all want to come sleep at my house in Colorado and see snow. But the big thing with that is, I know it's fun. I'm going to have about 30 kids here this summer, I think, and there is no snow in the summer in Colorado. That's a myth. But the most important thing is that I'm seeing these kids for themselves. They have been abused. They have been trafficked. They have been turned out. They have been harmed. I don't know who they are. If they say they're a different gender or something else, that's not what I'm doing. I am there to love up these kids, make sure they have stability, make sure they can thrive into the future so they don't need to be in a government system. And that was my goal. And so these kids have been fantastic, but I've also heard horror stories because they act out as teenagers. And we have got to value the differences as we move a child forward. And that was something we worked on really hard with all of our governors, all of our child welfare agencies, with the kids. And the kids' voices, no one's going to argue with that. They really know what worked and what didn't. They saw their loved ones commit suicide. They saw people be sexually assaulted over and over. They saw a friend be locked in a closet, not be let out for 12 years. They know these stories, and they don't care whether somebody was Christian or Jewish or atheist. All they cared is that they could be saved. And so the church piece and the nonprofit piece and the secular piece are all necessary right now. Otherwise, we're going to fight about that. And that is not about the kids. We have got to remember the kids and why we do this work, and then deal with the other stuff later. But don't make it a reason why these kids can't get taken care of.
Just quickly, anyone who's watching, if you have any questions, put it in the Q&A box, please. How did you get into this work, Lynn?
I was a probation and parole officer for 18 years, and I worked federal probation and parole. And I remember one year when one of my guys came in and asked me to do a UA because he had used drugs. And I asked him why, and he said because he had just spent 3 weeks with social services and he needed to go back to prison to clear his head. And that made me realize that we really do have to do something better. We really have to change human services. But I was in criminal justice. And then my governor, Governor Owens, called and said, I heard you don't like the systems very much. Would you want to come work with me to make the changes? And I was a federal employee close to retirement. And I said, no, thank you. And he kept calling, went to work for him. Ultimately, that same governor called me and dared me to apply for a job to be a human service director. And I said, sir, I'm not a big fan of human services. And he said, well, then change it. And so I did that, really did use common sense, realistic practices, and we had amazing outcomes wrapped around a Head Start with a program called the Prosperity Project. 1,300 families successful, standing on their own 2 feet, never needing government again, those kind of things. So when the president called and said, would you want to make a difference for human services? I couldn't say no. My family supported it. And all the families, here's the best part about this job. All of the families that I had helped, we would have dinner at a school once a month to talk about challenges and how they were doing and what system barriers were stopping them from being successful. I did that for years. And when I told them I was leaving, they didn't look at me and say, oh man, is this going to end? They looked at me and said, wow, we are going to Washington. And with that kind of feedback, that the families believed that their words had trained me enough so that I can help make a difference, it's why I do what I do. It's why I talk to the youth. It's why they'll all be at my house this summer. It's why we are trying to knock down things that get in the way. But the rules and regulations have to also include faces, not cases. We have to look in the eyes of the people we're serving, parents and kids, and then we move the rules and the regulations, because it's not fair to them that we are trying to fit them in a box. And I think we're on the right path. I think everybody that works in the system is trying. It's just complicated, and it doesn't have to be this hard.
Can I ask, I've been thinking about, your campaign to get people all in, and obviously this is an issue that, I think politicians and policymakers are interested in. It's an issue that, churches and people very involved in churches are interested in. But I'm just sort of thinking about kind of your typical middle-class American now, and how much or how little contact they have with this system now. And I think about something that a former child welfare agency head once said to me about recruiting foster parents. He said the system is not set up to find foster parents who have jobs. In fact, it sort of rejects them. And, he was talking about some of the bureaucracy issues that we were talking about before, the last minute visits from caseworkers, the idea that you are, spending your days in family court, waiting to get a hearing and then being told to come back another time. But it does make me wonder, whether the way the system is set up, we are not kind of welcoming enough people who are educated, people who understand how to navigate systems, people who can demand accountability from courts and agencies. And I was wondering if you kind of have thought about like who we're attracting to volunteer to help these kids. And I include in that even some caseworkers and some people who go into family law and things like that. Like, what are the avenues that we have available to us to bring more ordinary, middle class, if you will, Americans to kind of have contact with the system, understand what's going wrong, and then help these kids?
That is a huge issue. And another thought on that, Naomi, would be, what about those of us who are empty nesters? I could do this. I'm not an invalid. I am not incapable at my age, but my kids have all been raised, and I have 3 empty bedrooms. And it seems like once you get over a certain age, they're like, I don't know if you should be doing this. And so I think we need to open up what you're looking for. And you're exactly right. People can work. You don't have to be a stay-at-home parent in order to do foster care. You need to do what you do with your own kids and know that that you could move this forward. And it's something there are a lot of stereotypes in our system that are trained through, and I think this is something we have to work with our universities who train our child welfare staff, that the system is moving faster than the curriculum. And we need to start helping our trained staff who come in. I think you've probably noticed most of our child welfare staff who come in, they're right out of getting their master's in social work. And then they see their first abused baby, and then they have trauma, and then we're looking for more staff. And we have to start working on funding, paying for the quality that we need, and then opening things up so that we could ask that question, well, why is it you only look for this type of parent? I had one thing I will add to this. We did very seriously take on disproportionality. And we were talking to the states that had the highest numbers. And one of the things I ended up doing was meeting with the Black Baptist churches. Because one thing that everybody kept telling me is we're not getting African Americans to step up to adopt. It's not quite their culture. And so I went to the churches and said, can you guys talk to your congregation and say, hey, we need you to help adopt kids. We need you to help wrap around families. And they said, we just never thought that was an issue. And so we had all of these congregations and people that were texting me all the time saying, we talked about it this weekend. We found some more families that are very interested. But no one just laid it out and said, hey, why doesn't the culture adopt other people's kids? We don't want disproportionality. Or why aren't we wrapping kids around because in that zip code instead of removing the kids? I mean, it's all of those questions that there is no one size fits all. And it's okay to knock on a door and say, hey, how come nobody's adopting from this neighborhood? How come nobody steps forward for our Hispanic kids in this neighborhood or our African-American kids? It's okay to ask the hard questions. It's okay. And we have to start doing that if we're going to make sure that all of our kids are taken care of.
Naomi, you've written about the war on adoption. Looking at the last administration and what went right, what's your plea that continue during the current administration?
I think, some of our conversation about the importance of faith-based institutions in this country's culture of adoption and, an ability to take in kids both through fostering and adoption is so important. And obviously I think everyone's waiting to hear about what the Supreme Court is going to say, but I think that, you need an administration that tells states that we need to be supportive of these organizations, and that, not every child is going to be able to be reunified with their biological parents, and that the family that is going to take in that child, they may be from the same community as the child, they may be from a different community, but the most important thing is finding a safe, loving, stable, permanent home for that child, and to find it, without letting that child languish in foster care for long periods of time. At the beginning of, when Lynn first started, I wrote a piece about something she said, which is we have the legislation on the books that should carry us, that should guide us well. It was legislation that was formed by consensus with Democrats and Republicans in the 90s. And I unfortunately think it often gets ignored. But what I hope, that the next administration continues to pay attention to how much those laws are being enforced and pushing them more in this direction.
And Lynn, do you have any advice for people who maybe working with the administration or in the administration, although they're probably too busy working with acronyms and trying to get confirmed? But what's your advice to continue keeping children in focus, being kinder to foster families, doing the prevention work so families that can stay together really do and get the help that they need?
My advice is, and again, it goes back to the governor that hired me, was focus. Pick what you're going to focus on. If it's going to be to get those waiting kids to zero and strengthen families, those are two great things to focus on, which can be doable and get done. Check, move on to the next big problem. But problems, when you hit those dominoes over, go away when you do it right. And so I would say focus. And I hope that everybody that's in the new administration will continue to be all in for children, continue to help these kids get forever homes, whether through guardianship or adoption or mentoring or whatever we can do. Continue that work and don't slow down. The kids, keep talking to the kids. Don't have just one youth that is your person that you talk to. Talk to all of these kids throughout this country. They can change the system. They have the ability. So that would be my advice, is those are easy things. Those aren't big, huge changes. You don't have to run that through Congress. And then the last piece is follow the money. One of the reasons I see less adoptions is there is not much funding for the adoption side of our system. CAPTA's good, but not funded well enough. Help us move. I know I worked with Congress on this, that everybody in Congress was all in. They knew what we were doing. Help them focus the money toward getting these kids forever homes and wrapping the services either through FFPSA or before that. We will have a completely different system, and it's not rocket science. This is really doable if you use your heart and remember the urgency. Ask yourself if you would do this for your own kids, and then do it. Don't talk about it. No more. We don't need any more planning. We don't need any more talking. It's time to move. We all have been doing this for years and years and years and years. Get these kids forever homes. We won't need a system that is as big or as complicated as we have.
There are people who are watching who are saying, I want to be all in. What do I do? There's a mix of people who are policy people and people who are interested in being educated to do more.
I will, if you all are willing, I can give you my email address. I'm going to continue this work. I'm going to continue having people be all in and helping connect people. And that would be through Johnson59LynnA@gmail. And you can email me. I will connect you with whatever state you're in to who is all in that state, because this can't stop. The kids, that is the biggest thing I received when I was leaving. I got more emails from kids, and even after, because as you can tell, I'm not afraid to put my email or my phone number out, but the kids kept saying, are you okay? And is my voice going to go away? And I have said, not if I can help it. These kids have been through hell and back. It is time that we listen and we continue to fight on their behalfs, with them, not for them. And they love that. So anybody that wants to come do a retreat this summer is welcome. The kids are excited. So I just think that we can't stop being all in. And the governors all know about this. We have to let them know it's not going away. Does that help?
I have to say that I've heard from people on both all, I'm not clear what side they have great respect for you and the work that you tried to do in that very limited period of time. So thank you for doing that. Naomi, any last thoughts about going forward?
I also want to thank Lynn, because I think she did command quite a bit of respect from both sides of the aisle in Washington. You don't hear that necessarily about a lot of people, in the previous administration, but I certainly heard it about Lynn. And I do hope that her work continues, and maybe she'll let us know soon what her next venture is going to be. I look forward to hearing it.
And I want to thank you all, because Naomi was my very first interview I ever did. I thought it was a practice, but she did write it up. But it was fantastic. And I love the work you do. It takes everyone in their lanes to be all in. And that's how we're going to make a difference. And I do value what you all have done. I watched it, I read it. And Naomi, I've tried to implement some of your suggestions. It's critical that we are all working together for these kids. So thank you for inviting me. I will let you know what I'm doing next. And this is great. Thank you so much.
And one last comment. One of our inbox people said, happy birthday, Naomi.
Hey.
Thank you for using your gifts for good. Thank you, everyone. On behalf of the National Review Institute and the American Enterprise Institute.